How long does someone have to be in withdrawal before starting Suboxone? Anyone who's interested really needs to have a conversation, a discussion on how long they need to wait before they start Suboxone, because there's a lot of different factors, and there's a lot of different options in terms of inductions, whether it's a standard induction or a micro induction.
When we start Suboxone, we normally have a standard induction, which allows the patient to go into withdrawal symptoms first. Then we start the patient on Suboxone. Now, you can use time. We can say, hey, 6 hours has passed, let's start the Suboxone. Or 3 days has passed, let's start the Suboxone. Or we can see how you feel. Are you anxious? Are you restless? Are you having a lot of sniffles, body aches, depression, kind of the things that normally go with withdrawal symptoms? We can use that also to determine when it is best to start. The number one thing is it safe to start the Suboxone at that time? Well, if we start Suboxone too early, we can go into precipitated withdrawal. Precipitated withdrawal is a severe withdrawal that can go anywhere from 12 hours up to 1 day. A lot of times, the only way to stop it is waiting time, giving more medication, which actually could require an ER visit, or just sitting there and adjusting the Suboxone dose or going back to your illicit substance. So these are kind of all things we want to avoid. There's a scale we all like to use called the COWS, or the Clinical Opiate Withdrawal Scale. And it kind of gives you a nice gauge of how you're actually feeling. We like to rate the score. So if you rate a score between 10, 11, 12, we normally say that's okay to start Suboxone, because that tells me that the time has passed enough for you to feel the withdrawal symptoms, which tells us chemically it's safe to start the Suboxone without maybe putting you at harm's way. We have different types of opioids that last 6 to 12 hours and some that can last up to 3 days. So let's talk about the three different types of opioid times that we like to discuss. So short-acting opioids, these are things like your heroin, Percocet, your Norcos. They're going to have a half-life between 6 and 12 hours. So what that means is the maximum benefit of the medication as it sits on that receptor to give you benefit, whether it's pain relief or the euphoria from the opioid itself. We're talking 6 to 12 hours. Then we have an intermediate one. They were talking more so OxyContin, morphine, MS Contin. These act just a little bit longer, and they can go anywhere from 12 hours to 24 hours sometimes. The next class is the one we're kind of worried about right now, and you've heard it in the news. You're seeing fentanyl everywhere. Our kids have access to it. People have access to it now. It used to be a drug that we used for chronic cancer patients that were terminally ill. That's how we took care of the chronic pain. So now that one can last anywhere up from 1 to 3 days in the system.